How does pornography affect our expectations and perceptions about sex? Is it true that women can experience multiple orgasms? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Pornography can affect our expectations and perceptions about sex by presenting unrealistic scenarios and focusing on performance. It can influence self-esteem, generate reductive views of sexuality, and desensitize those who consume it. Yes, many women can experience multiple orgasms in a single sexual session or over time. This varies from person to person and may require increased self-awareness and stimulation. Skin as a sexual organ. The skin is the body's largest organ and is filled with nerve endings. Physical contact, such as hugs and massages, can be highly erotic and stimulating. Sleep disorders and erectile dysfunction. Sleep apnea, a disorder characterized by interruptions in breathing during sleep, has been associated with an increased risk of erectile dysfunction in some studies, suggesting a connection between sleep quality and sexual health. Social stigma. Despite its prevalence, pornography remains a stigmatized topic in many societies, which can hinder open and honest discussion about its impacts and practices. In certain African countries like South Africa and Botswana, specific sex education programs have been created for people with disabilities, recognizing the importance of addressing their unique health and sexuality needs. Speed of arousal. Men can have a complete erection in just 10 seconds, and sometimes they only need to look at something that stimulates them for a few seconds. In contrast, women require stimuli more related to the brain, such as emotional intimacy and connection. Standing positions. Although less common, some women enjoy standing sexual positions, such as against the wall or leaning standing, which can add an element of adventure and risk to the sexual experience. Studies on the clitoris. Despite the importance of the clitoris in female sexual response, there has been a lack of research on this organ compared to the penis. However, there has been an increased focus on clitoral research in recent years. Syphilis, a sexually transmitted disease caused by the bacterium Treponema pallidum, has experienced a resurgence in recent years in several countries, especially in urban populations and among men who have sex with men. Tantric sex is a practice that focuses on emotional connection and deep intimacy. It emphasizes control of arousal and can lead to prolonged and satisfying sexual experiences. Technique. Differences. There is no correct technique for female masturbation, as each woman is unique in what they find pleasurable. Some women prefer clitoral stimulation, while others enjoy vaginal penetration or a combination of both. The concept of positive sexuality. Positive sexuality refers to a respectful, non-judgmental, and empowering attitude towards sexuality, which promotes pleasure, equality, and consent in all sexual expressions. The effect of music on sex. Music can influence sexual arousal. Some people find that certain music genres, such as jazz or R&B, can create an intimate and sensual atmosphere. The female orgasm. Although the female orgasm may be more difficult to achieve than the male orgasm for some women, exploration, communication, and practice can help increase the likelihood of experiencing it. The heart during orgasm. Orgasm can significantly accelerate your heart rate. In some cases, the heart rate can reach 180 beats per minute during an orgasm. However, note that this does not replace regular physic. The impact of sexual education. Comprehensive and evidence-based sexual education is crucial for promoting sexual and reproductive health, preventing sexually transmitted diseases, and ensuring safe and consensual sexual relationships. The importance of consent. Mutual consent is fundamental in any sexual activity. all parties involved must give their consent freely and consciously before engaging in any sexual activity. The influence of religion on sexuality. Religious teachings and moral norms can have a significant impact on people's sexuality, potentially causing internal conflicts between religious beliefs and individual sexual desires. The influence of technology on sexuality. Technology has transformed how people explore, express, and experience their sexuality, from online pornography to dating apps and high-tech sex toys. The prevalence of sexual disorders. Sexual disorders, such as erectile dysfunction or hypoactive sexual desire disorder, are common and can affect people of all ages and genders. The relationship between sex and mental health. Mental health and sexuality are interconnected. Having a healthy sex life can contribute to better emotional well-being and reduce anxiety and depression. The sexual response cycle. The sexual response cycle, which includes the phases of excitement, plateau, orgasm, and resolution, can vary in duration and experience for each individual and in different sexual contexts. Toys designed for anal sex. There are sex toys specifically designed for anal sex, with shapes and features that maximize pleasure and minimize the risk of injuries. Toys for P-spot. Stimulation. Toys designed for P-spot stimulation are aimed at the prostate in men and can provide intense pleasure sensations and more powerful orgasms. Training. Some men practice ejaculation control techniques, such as the start-stop method, to prolong their ability to maintain orgasm. Treatments. There are several treatment approaches for premature ejaculation, ranging from psychological therapies and ejaculation control techniques to medications and desensitizing topical creams. In Arab countries like Tunisia and Morocco, sex education may be controversial due to tensions between religious and Western values, making it difficult to implement comprehensive programs in schools. Uniform fetishism. This fetish involves sexual attraction to people wearing uniforms, such as military, nurse, police uniforms, etc. Vacuum devices. Vacuum devices are a treatment option for erectile dysfunction that involves a plastic cylinder placed over the penis and pumped to create a vacuum, helping to increase blood flow to the penis and produce an erection. Variability in preferences. Masturbation preferences and techniques can vary widely among women, and what works for one may not be effective for another. It is important to experiment and discover what feels best for each individual. Variable duration. The duration of a female orgasm can vary significantly, ranging from a few seconds to over a minute. Women may also experience multiple orgasms in a single session. Varied preferences. Women have a wide range of preferences when it comes to sexual positions, which can vary from classic to more unusual ones, depending on factors such as comfort, stimulation, and desired intimacy. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.